Bismillahirrahmanirrahim. Viewers, Assalamu alaikum. Imtiaz Warraich is again with the next episode of Global Review. As you are aware that we talk on different topics, different areas, and we invite people of that particular areas. And if that is the subject of politics, we invite politicians or political analysts. Similarly, if the matter is relating to some other areas, international affairs, any current affairs, social issues, we try to invite people or experts from that area. So today we are going to discuss dentistry, which is very important field in the health. And we have a very special guest with us who is specialized in that area. Let me introduce Dr. Maria Yousaf. She is BDS gold medalist. Then she has done MSc in endodontics. Then she is certified digital smile designer and C ortho. She is also certified in clear path aligners, C implants, fast braces, USA provider, and many other things. That will be explained by her. So Dr. Bai, thank you very much for sparing time for our program.
Most welcome, Dr. Imtiaz. It's always a pleasure to be here on the show, and to be of, assistance in guiding our viewers there.
So I would straight go to the question that please introduce a little bit more, because I have told everything. You can start from your initial education, from where you belong, etc., etc. Whatever you want to share with the viewers. Yeah.
Sure. My basic schooling is from Presentation Convent High School, Peshawar. Then I did my intermediate from Jinnah College for Women in Peshawar. Then I did my basic graduation in dentistry from Khyber Dental College. Today it is called KMU, Khyber Medical University. And then after that, I did my master's in endodontics from Rifa University. And then I went on for a series of diplomas or certifications in different fields of dentistry, like certification in orthodontics, implants, clear paths, Botox and fillers. Yes, I did my residency in digital smile designing. Basically, I'm into innovative dentistry, so I opted for the field which is called digital dentistry, which is currently state of the art technology, which is being practiced around the globe. And I'm a member of international DST community. Along with that, I am the only fast braces provider today, and now I have the eligibility to open up DST clinics, international DST clinics within Pakistan, and to go for my DST consultancy also.
Okay, Dr. Maria, why dentistry? What was your, why you prefer to be a dentist instead of other areas? You could be chartered accountant, you could be management expert, you could be HR expert, you could be psychiatrist, etc. etc. There are so many fields which generally people are adopting, or they are going to join those fields, and especially the ladies. They are mostly in psychology, they are mostly as psychiatrists, and similarly they are also going to join education. They are joining management side as well, and MBBS, general practice in medicines. So what attracted you in dentistry that you decided to get education in dentistry and also practice there?
Dr. Imtiaz, uh, I have always been a straight A plus student there. I have been a position holder also from time to time. In my intermediate, in my at the home level, home exam level, you can say. And then I stood second in the province in my entry test after I did my intermediate. And then once I was, I think the biology, the frame set of mind that I had was I took sciences right from the beginning. That was pre-medical, right? And then yes, I had the option of going into MBBS or BDS, where I was about, I think, 50th in merit on the list of MBBS, and I was roll number one, or you can say the first one in merit on BDS, right? And then I had to make my decision whether I should go opt for Khyber Medical College or Khyber Dental College, MBBS or BDS. And then I thought that there was a lot of discussion at home also onto that at that time. So I thought that, since dentistry is a specialty by itself right from the beginning in the field of medicine, and I was anyways, a distinction holder in that, right? So I thought that if I opt for dentistry, I will succeed more, whereas I am 50th on merit in Khyber Medical College, and I am roll number one or the first on merit. So why not opt for dentistry, which is a specialty by itself, and I can do better for
Okay.
my performance, or on the merit. I am currently standing as the topmost at
So
the
that's
topmost
this
level
is
there. So
so
yes,
this
that is what actually, on ground reality took me towards dentistry. And then came the journey where I have about, like, I topped all my profs. My first three profs I topped, and the final prof I stood second. And I was the best graduate, overall best graduate in Khyber Dental College there for my session. So I actually, was a distinction holder throughout, you can say. And I think my decision was the correct one, because it's your interest, and
that's better
your
actually.
dedication, your hard work, which all comes together. And hard
That
work with
matters. That matters.
interest. I mean, if you're in a field of interest, what you're doing, that really, then the journey that starts, and the journey that takes you along, after my graduation. Then I, went for my post graduation, so many different courses and, diplomas. And today I stand at a pace where I keep up with all the with the latest innovations, keep up with the at the international level more. And I try to promote dentistry within Pakistan at that level, because my graduations are mostly, or my certifications are mostly in alignment with the international.
Dr. Maria, tell me that in which situation or in which category you feel that in dentistry surgery is required, and generally what type of surgery? Because we have heard that sometimes people, when we go to a dentist and he says that he's going to do root canal. What is purpose of that? A little bit, please tell us a little bit, because for the common people or for people who are not much aware of this field, and why that root canal is essential, necessary, in which cases it is necessary. Sometimes we feel that a doctor is doing root canal because of commercial reason. Maybe he wants to do root canal and then they have to fix some crown there or something like that. So please explain this.
Okay, a very good question. Now, what is root canal and when is it required, right? So what a root canal is, basically, root canal is a deeper cleaning of a tooth. Superficial cleaning is done onto the crown of a tooth, right? And the deeper cleaning is done into the canal of the tooth, which resides in the root of the tooth. So when you're cleaning the root, as the name signifies, root canal, the canal lies within the root. So if you're cleaning the tooth at a deeper level, where you're cleaning the canals, shaping them, and then filling them later on. And after that, you'll fill out the crown, right? That procedure is called root canal treatment.
Generally, in your observation, what type of UC surgeries are required in
In
dentistry in
Pakistan.
Pakistan, specifically?
Okay,
Yeah.
see, let me tell you, the two most commonest of issues that we come across in Pakistan are dental caries, which is commonly
Mm-hmm.
called cavities. Okay, an
Mm-hmm.
issue which is commonly called cavities in layman term.
Okay.
And we come across periodontitis, gingivitis and periodontitis. What is that? Inflammation of gums and inflammation of the surrounding periodontium, or the supporting structure. These are the supporting structures which hold the tooth within the bone. So it comprises of the bone, periodontal ligament, etc. Okay, so what happens if what's the reason for that? Because we are not very meticulous about our brushing techniques and brushing routine.
Okay.
Now, and then number two. Number two, we never go and visit our dentist for regular consultations. We always wait for an issue to arise. Only then we enter a dental surgery. So we do not focus on to preventive dentistry. If we focus on to prevention, then you must be knowing that just like you have to wash your face and take a shower every day, the same way around you will brush your teeth every day uh, after breakfast and before going to bed. And then certain amount of plaque will always be present, which will turn into calculus. And depending upon your dietary habits, you might be exposed towards staining. So in office, scaling and polishing is mandatory. Whether you require it or not, six months 6 month a 6 month checkup at your dentist is mandatory. But if you have dental issues, you will be advised to visit the dentist as per the dentist's call there, right?
What at what age he should start going and getting consultation?
A very good question. A very good question. As soon as a child is born and comes up with the first tooth, usually it's in the books, it's marked as 6 months on an average.
Okay.
Why on an average? Because it varies with from individual to individual. A child might come up with a tooth at the age of 4 months also. A child might be born with a tooth also, right? And a child might have delayed eruption, and it may be that it might be that he's past 1 year of age or 1.5 year of age, and he's coming up with his first tooth. So that usually varies. Okay.
Okay.
So what do we do now? So what do we do now? As soon as the child comes up with the first tooth, whatever the age, bring the child in the dental surgery. Because first, he will be dependent upon his parents for the maintenance of hygiene. At that time, we will also notice his growth pattern, skeletal jawbone pattern,
Because
right?
generally,
It
Dr.
could
Bari,
be,
generally
yes,
people don't take care during milk teeth. You see,
yes,
generally
yes.
they
That's
call it
that's the that's the that's the I think that's the irony there.
misconception.
That especially in our, now you were talking about the common issues in Pakistan. This is the most commonest of issues, where in surgeries we need to teach the parents, because they say the very common answer question to you would be that these are just simple milk teeth. Why to treat them? Let them shed, and then we will come, or please treat the permanent teeth only. Just let the primary teeth be as such, even if they have cavities, even if they have some stains around them, don't treat them. Now if we don't treat them, what happens? They are maintaining the space for the permanent teeth to erupt. So premature shedding, I mean, if you're not treating a tooth and it requires an extraction, so it's prematurely extracted, right? Then the space which was available will become fibrosed, and the underlying tooth might not erupt in its correct position. So then hereforth we come across issues like malalignment, which need where we require braces later on, right?
Okay.
So we need to understand the importance of that.
So similar, I have similar question, but on in another way. At what age one should start using brush and toothpaste, and what type of toothpaste or brush should be used?
Okay, a very good question. A toothpaste in general routine, if not advised otherwise by your dentist for any for any diseased condition, should always have a very high fluoride content. Very high fluoride content. And there are a couple of ones in Pakistan which I normally recommend, but I always say a high fluoride toothpaste. I will not take the name of the brand right now, but
Okay.
which is my favorite brand. But I think that what one can do is, at a general note, a high fluoride toothpaste is a good one, which has the power of causing remineralization, okay, which is required. Okay, so that is what I recommend, and I don't believe in using medicated toothpastes if it is not required, because I always say, if you don't have a headache, why will you go for a painkiller? Similarly, if you don't have bleeding gums, why will you go for a toothpaste which is available in the market for a condition like bleeding gums there, right? Or a condition like sensitivity. So avoid using medicated toothpastes till you are not advised by your doctor, okay, to use them. That's my same goes for the mouthwashes.
Okay, Dr. Maria, actually you see that the one is major problem that people are not much aware about this type of, you see, uh, precautions, and at what time they have to move and go to the consultant for any ailment, especially in dentistry side. You see that in villages life, I have seen and noticed that some people they use salt to clean to clean their teeth. What you people or the people who are in your field, they are doing something to aware the people, and especially in schools, in professional areas, in you can say universities, or in villages side where people are not much aware.
Every doctor has his or her domain there, right? Some are working in government hospitals, some are working in private hospitals, some are having their own clinics there, and then some are into awareness sessions, right? Now my voice to you can currently, or to our viewers, can be reached right now via a talk show, right? It can, what we can do is also conduct physical awareness sessions, dental camps we call them, with checkups, with first a lecture and then checkups there. I myself have worked a lot in the private sector, in schools, private schools like Beacon House, City School. I've been invited from time to time, by principals in Diplomatic Enclave, Roots, Head Start, Frobels, all these schools which are there in Rawalpindi and Islamabad, because I myself have been leading a practice of in I've led a practice in Barrier Town for quite some time, and I'm currently taking my patients by appointment in Islamabad and Barrier Town both. But nonetheless, I believe that the technologies, if we bring in, since I'm into innovative technologies, if I bring them, the only way that our viewers or our patients can benefit from it is either when they visit the practice themselves directly, or by a communication via media, right? Social media, our television, and then comes our physical awareness sessions. Now, there are other doctors who might be working in our government hospitals, and then they are recruited by different companies, and they're requested to visit our peripheral areas, okay, our peripheries, our villages, for dental camps and sessions, and then they go where there is a mass dental, there are on a mass scale dental camps are conducted, and they provide them with these samples of toothpaste and toothbrushes also, and there are talks also, I believe, which are conducted with physical checkup. So it depends upon the extent of the camp there. So these are the modes which are being carried out currently. But yes, my campaign right now in Pakistan is that we need to implement, like any other country, preventive the importance of preventive treatment, because we over here, by our psychology as a regional psychology, believe in visiting our dentists only if we have issues which are
Actually,
there.
actually,
And then,
generally we are reactive people. No?
and yes, and the other thing is that we are our people are very enthusiastic about discussing their problems within the community, and taking going for home remedies, which we as doctors negate we negate, because there are many myths and misnomers which need to be corrected. Like you said, I mean, now you can't clean your teeth with raw coal, right? Okay, if you're using salt, at the most, what are you doing? Exposing your teeth to some coarse grains, right? You might mix it with some, make a slurry out of it by mixing it with some solution or some gel like or a cream like formulation. What you aim to do is, you feel that your teeth are going to, with the abrasive action, they're going to be more whiter or more cleaner. That's, I think, what you aim to achieve out of that. But what is the chemical that you're using? I mean, how aggressive you're going to be? Because brushing, if it's regular, we need this a super soft toothbrush with with we need a super soft toothbrush with a toothpaste which has a high fluoride content to work better without causing any recession which is there as a result of excessive abrasive action of a hard toothbrush, which can occur, which I mean, gingival recession can come up as a consequence of hard toothbrushing, right? As a consequence of hard toothbrushing, or if you're using a dental abrasive which is not advised, right? So I personally contraindicate usage of extremely hard toothbrushes. Even a medium one is not recommended by me, because you tend to then apply a lot of pressure and force while you're brushing. Your technique should be optimum, where you're covering all the surfaces of the teeth with sweeping motions or circular motions, yet and use a dental floss to clean the interproximal areas. But if you're but those, again, if there's these misnomers which are leading you to, because of the discussion within your community. Maybe you're a villager where you're being advised to use products like coal and salt. I mean, we don't advise them. We will correct those misnomers, because we are not focusing upon the importance of consultations and scalings and polishings, which will remove the accumulated debris we call with the vibratory action, right? But we are focusing on to products which could be harmful for the teeth. Now, if you're using a lot of abrasives, what's going to happen? Your enamel is abraded, right? The superficial layer of tooth, which is enamel, that is abraded and worn out. You end up having wear facets. You end up having loss of tooth structure, and then we need to see you again to build that tooth structure up with restorations.
Food or cuisine you like? Which are your favorite?
Okay. What's the food or cuisine that I like, which is my favorite there? Okay, I always say that I'm very fond of food. I'm a very I'm a very person who you can call as a foodie or a food loving
Okay.
person there. But I will always appreciate a cuisine, whether regardless of whatever cuisine it is. I will always appreciate it if for the authenticity of its taste. Meaning, if you're opting for Chinese, it should be authentically made. If you're opting for something which is oriental, then again it should have that spice level, or those that level of as you would call it, the level of herbs in our Italian cuisine should be
Yeah.
balanced. So every if you're opting for our traditional cuisine, in our traditional cuisine usually we have a lot of it again depends upon what type of spices you're using, what type of meat, what type of a dish you're coming across, whatever's there, that should be well made. That's called authenticity of flavor there.
From where you judge the authenticity? From the name of the restaurant, from the name of the cook? How
With
you?
my experience, only with my experience I can tell. Like, if I taste something, I can tell, oh yes, this is authentically
So
made.
first time,
Does the name
first time you will
justify
try.
the flavors or no?
So first time you will try that food,
Yes,
then you will
yes,
decide about the authenticity of that
yes,
and what
yes,
type of
yes,
quality
yes,
of that food has.
yes. And
So
I will
first,
always return. I will always return to that place if I feel that the flavors are, you know,
so firstly you are putting
authentic.
yourself. Firstly, you are putting yourself at risk. You see, when you are going to.
And you see, I think now we are so well apt with with different types of cuisines there. I try to play with different flavors myself,
Okay.
just to replicate the original tastes or flavor of anything that I'm making. I mean, now it could be something which requires to be bland, right? If there's a dish which requires to be bland, now what happens? That dish should should not be spicy. It should not have extra spices or herbs there, right? But if there is something which requires to be spicy, okay, then that should not be bland, right?
Okay.
So it always depends upon what type of cuisine you're opting for. And yes, it depends upon your mood also. Maybe today I'm in
Ah,
the
yes,
mood for
certainly,
something which
certainly.
is
Mood and
which is
time
yes today. And the weather also. I
and
mean,
weather
these
also.
all, weather also, yes. So I could be today, I could be in the mood for something which is
And further is
very well
and
baked.
company as
It's
well.
in,
The company you
pardon?
have. at that time.
Oh, yes, yes, yes. The company you have, whether you're sitting with your friends or your colleagues or, other way, family. So it all depends, where you're sitting, at what time you're sitting.
What type of dresses you like, or the dresses you feel that you are comfortable while wearing those dresses, if you want to share?
Okay. I'm basically, see, I will always dress for convenience, and and according to my lifestyle, being in a working environment where I have to work onto a patient's,
Hmm.
um, I'm mostly at my unit, you can say. So I will always opt for something which is like a simple shirt and a jean with
Okay.
my coverall and my scrubs. I'm mostly into my Western wear because it's you have you're very free and very mobile to work onto your patients there, right? I will be very simply dressed. Um, I am more into, simplicity. I find that more elegant. Okay. I'm not too much into extremely, you would say,
Glamorous,
yeah,
glamorous
I
dress.
am not too much into a lot of, lavishly adorned outfits there. That's not my style. But, and I will always dress as per the occasion. So mostly during my day hours, you will find me in a simple shirt and a jean and my scrubs and coveralls.
Okay, what is your recommendation about ladies? Because generally I have observed, and people certainly will agree with me, that in dentistry, there are very less numbers of women who are in dentistry field. What you will recommend to the ladies that they should join this field much, and you can give them or share with them about the merits of dentistry, specifically for women.
Today we are in an era where I feel that girls and boys, I mean, both are being educated, right? Both have both have that power and knowledge to choose their own fields and then to come into the working environment, right?
Okay.
Now, when firstly, whether it is a boy or a girl, your interest really matters, right?
Okay.
If you're interested in the field, I mean, you will always be working within the mouth onto the face. I mean, your head and neck basically comes under the domain of dentistry there, right? Under the domain of dentistry. So you will be dealing with aesthetics also if you want to, and today's era demands that, right? I mean, I always say, if you fix the teeth of the patient has a nice smile, but the patient goes with a, certain facial with a facial profile where he or she has something like imbalanced
Hmm.
lip contour, right? You can say the upper lip is short, the lower lip is over full. So if you don't balance that out, overall the patient is not going to look nice. Okay. If the patient has an aging premature aging which is very visible, again you need to go for certain amount of, so you need to go for certain types of treatments which the patient might require, right? So so it's your interest in the field which matters. Okay, for girls, if you're saying specifically, the merits would be what I've mostly seen, though I feel that, I mean, on a longer run, girls and boys themselves can be very good surgeons. But generally, they say that in dentistry, you can have hours of work as per your own choice. Meaning, those who feel that okay, they just want to work in the morning, not in the evening. Okay, they can do that. If they say I just want to work in the evenings, not in the mornings, they can do that. They can take their patients according to their own will. But obviously, as you excel and as you grow in your field, your hours of commitment that increases, right? So uh, there is a stage when you're entering a field, and then there's a stage in which you are on to the next milestone of being of excelling in that field, right? So once I mean, the patient might demand that, I don't want treatment from anybody else other than you, doctor, right? And that number of patients will keep on increasing with time. So your time, your dedication to your field, and with experience, you might even be going for further qualifications, which is the need of the hour, which is called continuing education program requirement, right? It is a continuing education program requirement which is there across the globe now. Those who keep up with international conferences, those who keep up with the international schools of thought, which are there, which are circulated across the globe, they are the ones who are the most updated, right?
Okay.
So girls or boys, when once you enter a field and you're excelling, your hours of dedication will increase, but that can only be if you're interested.
Yeah, sure.
Isn't it so?
So yeah. So next question is that
So
being a girl or being a woman, uh, did you find any type of usually difficulty in during studies or during professional? What was that, if that was in your life? And generally, because in our society, you see that for ladies, especially when they practice or when they are in profession, they have many challenges, you see. And you see that our society is not much developed so far as in the West. So, did you find any type of difficulty?
okay, Dr. Imtiaz, when it comes to my upbringing, I belong to a family where I had, I think, uh, if I was totally encouraged onto the educational platform. In fact, I come from a background where my parents, they insisted upon schooling on a daily basis. I mean, I don't remember even missing my school one day unnecessarily, right? Or scoring underneath A plus was not acceptable. So from day one, we were instilled with that positivity that you will be achievers in life and become something in life yourself, right? So it was the other way around. If I had not become something in life, that might not have been acceptable. So I had a lot of support, meaning in pursuing my profession. I had a lot of support in continuing in any way that I wanted. Okay, I was supported throughout, onto schooling, my professional level, going on after that, even into onto the level of practicing, and I did not like I come from a family of encouragers, or a family which is very well educated on its own also, which understands the importance of education, right?
Okay.
If you're looking towards that. And then yes, once I always say that in any it's not just in medicine. If you are into office work, if you're an entrepreneur, you're doing anything on your own, setting up your business, every field requires commitment and dedication. I mean, today, as you were saying, we are in an era where we come across so many different fields, and that's how the nation is growing, the country is growing. That's progress. So we come across so many different fields there, but every field is that way, that your commitment will grow as you're growing yourself, as you're excelling. So you will, yes, you will sometimes balance out your life in a manner where you will. In my case, I've made it, generally it is a bylaw, unless or until I'm committed on a weekday with my family, but I will mostly give my weekends to my family. They're my girls are my priority. They are grown up girls who themselves have their own independent routine, in a manner that they have their schools in the morning, their tuition hours, their kari sab hours, and when it comes to my family. And then they have their TV hour and bedtime hour. So that's about, I think, for every child who's school going, whether he is in primary years or in O levels, A levels. Now the child is growing. As the child is growing, he's maturing and becoming more independent in their routine. And then they don't even like too much of interference from the parents, right? So now what happens is that I try to balance it that way around. Otherwise, I think weekdays are all working days and school days for everybody at my household.
So, what are your future plans? What you want to do, or what you want to see yourself in future? That what type of you see expansion in your professional you see activities, and what you want to contribute in this specific field?
For my profession would be, I'm planning to open up a startup with a chain of
Okay.
hospitals within Pakistan, and that chain will continue abroad also, right? Currently, I'm doing a lot of work onto it, where I plan to have a site office first, a clinic or a couple of clinics together. That's what I'm doing. And along with that, the hospital would again, by the same team, the hospital, that would be like the foundation for the start of the
So
hospital also. And I have to, what I'm doing is basically I'm trying to meet up with the international criteria or parameters where the dental side would be the first one in Pakistan to be internationally acclaimed DST clinic, or the internationally certified DST clinic. So for that, they have their own criteria where the hospital has to be a totally digitalized one, having digital footprint there. We have to go paperless, whether it comes to our the patient record data, or your accounts, or your the generation of your invoices. It totally has to be, in a digitalized manner, right? So the staff would be all Filipina. It's going to be all, an international based international staff there. But we will be having training rooms where we then train our own people at that same level, where they can execute as meticulously and as efficiently and as precisely as a foreign trained staff on a at a longer, as you would say, at a longer run there, right? So eventually we will also incorporate them in different branches, and the plan is to have the medical side would also be up to mark, where the plan is to again incorporate foreign groups there, to open up departments within Pakistan. And then we're very fortunate enough now that we have the services of medical health cards. So initially, with my experience, what I felt is that people who want to get quality treatments done and they could not afford to get quality treatments
yes,
done, they can now get quality treatments done because they have the
more
affordability for
much
it. Right?
resources.
Yes, yes, yes. And inshallah, with such a good initiative,
That's good.
every program grows and matures more and more with time, right? So this was a very big jump, that we have a good program. Now inshallah, with time, we're hoping that the dental health services are also included, and other increases, or there is a more of a progress onto the health card system there, or the health card program there. And then people will be able to benefit from the from the onto dental health services also from the health card there. I've been trying to coax our insurance companies within Pakistan to.
Generally in Pakistan, I have witnessed that healthcare is generally treated as you see cosmetic treatment. So they don't cover in health. You see generally, I have seen. So what do you think that is there any future that this area is also covered within the health requirements, or you see health requirement of everyone
See,
treatment?
Dr. Imtiaz, now see, teeth are part of our body. And an emergency, a dental emergency, can be as fatal as any other emergency. I mean, if you're having abscess, an abscess can lead to septicemia. An abscess can lead to spread of infection or cellulitis, at such a fast pace that you can just, it can it can reach towards your vital tissues in a layman term. Okay. I mean, if there's a molar which is infected, okay, maybe that your whole of your side is swollen in a matter of hours, right? So this is again a misconception. Aesthetics is there again in general medicine also, right? So we need to what we need to understand is that we have emergency treatments, interim treatments, and aesthetic treatments. All are there in dentistry also, right? Now if we look at if we take like if we see where we're lacking right now, I've been trying to, as I told you, coax our insurance companies to start up with dental insurance plans or policies as per the socio-economic status of an individual or income of an individual. We can have a preventive treatment plan and an emergency treatment plan included at a basic level of insurance for those who have who have a low to an average grade of income there. And then those who can afford to pay more premium, they can move up towards interim treatments and then towards aesthetic treatments. But since this has not been worked at within our country, so what we need to do is our companies need to sit our companies need to sit and work work on those parameters, where they actually do physical working onto it, and make these make a plan, and then present it towards our companies and individuals, so that they can benefit from it and they don't hold their treatments due to lack of finance there, or you can say a lack of handy cash, right? So what they can do is they can keep on paying the premium, and they can get their coverage by the companies there. So we need the working, where the company is also not at a loss. And if you're having preventive treatments done, so obviously you will have lesser of emergency treatments, right? Because your arch is taken well care of, and that's not expensive to a very, at a very it's not very expensive then. preventive
Okay, Dr.
treatments
Maria.
preventive treatments are not very expensive.
Okay, Dr. Maria. Uh, can you tell us that which weather you like much? Which season or weather you see?
Which season
Very
of
cold.
weather? Okay,
Yeah.
I think Allah has blessed us with all the four seasons, like summers, winters, and uh, spring and autumn. So it's always that towards the end of one season you're looking forward to the next season. I mean, we have a very long span of summer in our country, but towards the end of winter, you're looking forward to the spring, the change of weather, and the summer there, right? And halfway through the summer, you would be because we're in an area where the sun is very potent. So then halfway through the summer, you would be saying that um, let's move towards the northern area for a breather there, or to enjoy the lower side of
Low
temperature,
temperature.
in a fresher surrounding, in a greener surrounding there. So I think it's human nature that you as soon as one season is halfway through, you're looking forward to the next one, the change there. So that's how it goes. That I like in winters have their own benefits. I mean, because we've had a very long summer, so we usually like the winters a lot, because the span of winter is shorter. But then again, towards the end of winter, I really look forward towards the change, the springtime and the summer coming in, because you're finally rid of your outerwear, you're rid of your those layers which you've been wearing throughout the winters. But
Heavy
at the end
dresses.
of summer, that's very welcome, because I
Yes.
think the sun has done a lot of damage towards the end. So you're looking forward to the layers and the cold air. So that's how it goes.
So, Dr. Maria, it's a very much pleasure and honor for us that you spare time for us and for the viewers. Any message you want to share with the people who are watching you at this moment?
Dr. Imtiaz, I always encourage my viewers. I always encourage my patients that investment onto yourself should be first, meaning onto your general health, your maintenance, and your dental or your orofacial health, as you would call it. And then comes the investment onto the rest of the things. Because if you're maintaining yourself, you're preventing diseases, you're a healthier person. Investing onto your aesthetics yourself, I mean, uh, uh, investing onto your own self or your own aesthetics is better than onto purchasing articles
Oh,
to make you look aesthetically good. Meaning, if you're purchasing a couple of outfits, please avoid purchasing a few outfits, but invest onto your skin, because that skin you will carry everywhere.
mhm.
Those teeth, if you're investing onto your teeth, you will smile every day in front of the mirror, first for yourself, for that that boost of self confidence. And every human who looks at his or herself in the mirror and looks good in the morning leaves on a good note from home also, right? Even if you're at home, I mean, if you're a housewife or if you're a person who's at home, should have that boost there, the first boost in the morning, right? And then if you're going towards your work environment, you're socially and you're a socially very interactive person there, you would again want to look good everywhere, right? So if you're looking good yourself and you're maintaining yourself via investing money and time both onto yourself, you are, you are, you will have a longer life, and a well-maintained life also, a quality life also. And then starts the investment onto other material things. We are purchasing cosmetics around the clock, but a smile is the best cosmetic to wear, and a sunblock is the best preventive mode to save your skin, and to let it stay at its original form for a longer period of time, especially in our country where the sun rays are very potent. So always visit your dentist for your regular consultations, whether you require them or not. Don't wait for a problem to arise. Maintain yourselves. That's and on a general note also, maintain your general health and hygiene also, because this is all interconnected.
Certainly.
I mean, teeth are just a part of your body, right? Same goes, your face is the first thing which attracts you and others towards yourself.
So thank you very much again for giving us time, and this is very nice and useful message. I guess that everybody will carry this message and will act upon.
Dr. Imtiaz, it's always a pleasure to be here on the show. And yes, inshallah, we will come up with, some other talk, some other topic, some other time also. Take care. And it was lovely to be there on the show with you.
We will welcome your comments if you have any for the improvement of our program. And certainly you can also ask questions about dentistry, and will share those questions with Dr. Maria, and she's available, and you can get advantage of for the treatment of your teeth and your family members. So take care, and bye bye. Assalamu alaikum.